I had felt a small lump in my right breast and ended up finding out that I was being diagnosed with breast cancer. It was a stage 3, pretty aggressive breast cancer.
And the year after I retired, I went for a test, and the doctor said, we see something on your lung. It looked like ground glass. I was diagnosed as stage 1 at the time. It was a trauma. When you get that diagnosis, you're hit right between the eyes. It's very difficult.
At that time, I had 2 girls, a freshman and a senior in high school, and just kind of the unknown. What comes next, and where am I getting the help, and what are my options?
Here at Smilow, we have cutting-edge disease-focused treatments that patients come to get cures for their cancer. The integrative medicine program focuses on the human side of the patient. What I see with my patients who use integrative medicine services is a sense of being able to reflect, to be able to express themselves, or be able to get physical relief from the services that are provided.
One of the best ways to describe integrative medicine, especially in terms of cancer care, is if the cancer is a weed, your oncologist is phenomenal at dealing with that weed. They can focus on it. It's really our job to focus on the rest of the garden. Build the flowers, make sure that the soil isn't hospitable to the weeds anymore.
I went through chemo and the surgery, and I went home. And I languished for about 6 years, just sitting around home, feeling whatever, sorry for myself or whatever. And then I met Dana Brewer.
One of the highlights of being an integrative medicine practitioner is that I get to go upstairs and engage with patients that wouldn't normally choose integrative medicine because maybe they are unsure of what we offer or they haven't heard of it. We do yoga classes, we have Tai Chi, Qigong, we have meditation classes, Zumba classes. We do huge creative expression, collaborative projects, and individual projects. We have massage, we have Reiki, and when I say there's something for everyone, there really is, because at the very, very least, there's breathing, and there's breathing exercises, and there's just ways to help alleviate stress and feel better.
Many of these services are offered online or through Zoom or through phone-based treatments. My patients love the fact that they have all these different services to choose from that's provided by the integrative team.
When I met Dana, she indicated Smilow wanted to make 1,000 white birds as a project, and if I'd like to participate and learn how to make that. And I jumped at the opportunity. There was a doctor from Malaysia. As a boy, he wove fishing nets. He took the 1,000 birds and wove them into a fishing net. And it was displayed in the Smilow lobby for the longest time. And then they took it down and cut the birds out and gave those birds to the cancer patients. And that, now that I think about it, that was really the impetus for me wanting to do it. It's kind of like planted the seed.
Sometimes it's just simply about experiencing joy again, because they've become so used to this pattern of chemotherapy, feeling ill, feeling sick. But if you can give them these nuggets of happiness, then you can really transform their journey and who they are and who they become. And so everybody's always seeking to be happy. Once you get the weight of cancer on your back, it's so much more challenging to go into that place. But that's the strength of integrative medicine. We give the patients those tools to get back into that place.
The support really raised me up. It gave me so much strength to clearly battle, both for physical pain, but just my emotional well-being. As much as I wasn't a yoga person, and maybe still am not, I looked forward to going there. I looked forward to the conversations that were held. I looked forward to the praise that was given for small little gains from week to week. I just looked forward to the comfort, really, that a lot of the programs provided me.
Integrative medicine is another layer of support for patients going through treatment and beyond to help them achieve that hope and optimism and that connected feeling that they need.
When I walk into the room, I'll say, hello, my name is Desi. I'm a volunteer here, and I'm a 13-year cancer survivor. During my time here, I learned how to make origami birds, and today I make them for cancer patients and other nice people. Will you accept this for me? I couldn't give them away fast enough because I would get this shot of dopamine in my brain and I'd walk out of the hospital like 6 inches off the ground. I think I gave 2,000 birds away in 2018 and 19.
I'm reminded daily that I'm a cancer survivor, but I find that I am incredibly resilient and I believe that I am due to the strength that I gained from those people that I met along the journey. I was fortunate enough to have a great support system already in place with my family and friends and my community, but I think I gained more strength as well from the doctors and nurses and the staff in the integrative medicine department and just the people that I've met through becoming involved with the Looking Forward fashion show. It continues to show me the importance of the program and of giving back.
Every dollar that's donated ends up affecting countless patients, providers, and family members that we can't even imagine.
We're a growing and developing program, and we need support. We need help to create that. We really do rely on the support of people to help us grow and help us thrive.
He started with the integrated services. He just changed like that. He was the old Desi, very positive and very up. And without the Creative Expressions program, I think he would not have been the man he is today. I really don't. I think he would have went into a deep depression. It was a godsend.
So what good is treating them on physical level if you leave the emotional and spiritual level untouched? This touches that. This gives us a chance to heal completely.